And now I'd like to welcome from the White House Health Reform Task Force, Arizona Representative Kyrsten Sinema.
Great to be here tonight. You know, I could barely get into the parking lot. The streets closed down. There are folks campaigning for health reform all up and down the street. So let's cheer for that. Now, this is an amazing crowd to gather on a hot evening in Arizona. But I want to just thank all of you for taking the time to be here, not just tonight, but for every day that you're speaking out for health reform in our state. See, Arizona needs health reform. Arizona needs health reform more than any other state in the country.
Absolutely.
Arizona has one of the highest rates of uninsured folks in the entire country. Do you guys know that? Yeah. One of the highest rates of uninsured folks in the country. And of those who are insured, we have some of the highest rates of folks who can't change their insurance because they have pre-existing health conditions. That maybe is the case for some of you, right? Arizona is a perfect example of why this country needs health reform and needs it now. You know, a couple of weeks ago I was talking to someone and she said, you know, Kyrsten, why do we have to do health reform so quickly? You know, why are we moving so fast? And I said, you know, let's think about this for a second. Every American president for 60 years has talked about health reform. If 60 years is fast, I don't want to see slow. Or have insurance but are paying too much and not getting enough, probably many of you, understand why you're chanting now. Because every day that we don't have health reform is a day that those folks live in danger.
That's right.
What if one of their kids gets sick? What if they develop a disease and get kicked off their insurance? What if their mom falls down and breaks her hip? What if they can't meet their family's medical needs? And that's happening all across our state and our country right now. And folks, that's why we need health reform this year. Why he wants health reform. All across America, families and businesses are paying more and getting less from their health coverage. 50 million Americans are living without health insurance, and for those who have insurance, they're not getting the kind of coverage they need. Folks are choosing to stay at their jobs solely because they need that insurance. And people who want to start their own businesses, to live the true American dream of having a small business, can't do so because they can't get the insurance to do it. And that's why our president wants health reform this year. Now, President Obama, as you know, is a very smart man. And he has said to Congress, look, Congress, you need to figure out how to do this, but let me tell you what 3 things I want. I just want 3 things, and I'll sign this bill. Reducing costs for families, for business, and for government. We're all paying too much and not getting enough. We have to reduce costs. Number 2, we have to protect choice because that's part of the American dream. You have to be able to choose your doctor, your health plan, and your hospital. People across America should be able to get to choose who they want to see when they need medical care. And President Obama says, Congress, you must protect choice. And finally, number 3, the most important part, the president said, Congress, you've got to figure out a way to get affordable, quality access for all Americans. And that is why President Obama supports a public health insurance option. Choice for people who today have no choice because of their health conditions or because of the prohibitive cost of health care. People who today live with no choice or only a limited choice. Like a woman I met a couple weeks ago. She's on Medicare Part D. She has rheumatoid arthritis, lives down in Casa Grande. And Lydia told me her story. To control her rheumatoid arthritis, she has to take an injection every week so that she can walk and be healthy. But because of that donut hole in Medicare Part D, she can't afford that medication because it costs $1,800 a month. $1,800 a month. That's more than Lydia's mortgage payment. So Lydia goes without that medicine and has trouble walking. Is that the America we live in? No. The America we live in says Lydia gets the care that she needs. And that's what President Obama is doing right now with agreements like the one he's made with pharma, where they've promised to reduce costs by $80 billion over 10 years and close that donut hole so that people like Lydia can get the medication they need so she can go see her grandkids, so she can walk and travel and do her own grocery shopping. That's what this American dream is about. Now, you all have seen what's been happening in the past couple weeks, right?
Yes.
Now, I gotta tell you, a lot of that is overblown, this idea of people hooting and hollering at these rallies and stuff. A lot of that is just made up.
Stuff them in the donut.
It's only maybe we just need to get them some better health care. Now, I gotta tell you, though, those folks are not everywhere. We've held 7 town halls as the White House Health Reform Task Force here in Arizona, not a single disruption. So the fact is that most Americans want health reform and they want it now. But let me tell you what I need from all of you. I need your voices.
Yes.
Because right now, the folks who are getting their faces on TV and their names in the media are the few who are making up stories, distorting the truth, and trying to scare Americans away from what everybody wants, which is health reform. Okay, now how many of you are planning to do phone banking or walking for OFA? We need you, because coming to a rally is important, but it is not enough. We need you tomorrow and the next day and next week and next month until health reform gets on the president's desk and is signed. So will you all promise to do that? I couldn't hear you. One more time. As I leave tonight, I want to say one last thing, and that is this. When I woke up this morning and saw that Senator Ted Kennedy had passed away, like many of you, I was saddened, I was touched, and I was hurt, because I wanted Senator Kennedy to see health reform enacted. But although Senator Kennedy passed away early this morning, his work will continue, and we will do it.
Thank you, Representative Sinema.